Let's see, Blue Shield, I think Erica talked about, what if you have band 23 positive only? 23 is highly significant for Lyme. A lot of Lyme literate doctors say if you have only band 23 positive, treat Lyme. Let's see, why won't my insurance cover this? I think Ron addressed that. Biomats. Biomats are, we have an infrared sauna at the center, which I highly recommend people get into using infrared saunas. You can even look locally for them. And what happens with an infrared sauna is it penetrates the skin 3 inches or so. Spirochetes do not like changes in temperature. A biomat is a amethyst mat. It's like run with amethyst and something else that people can buy online. You lay on it, and I think from what I understand, it penetrates the skin further than the infrareds.
What is it?
It's called a biomat, B-I-O mat. When are doctors who are consistently misdiagnosing people going to be held accountable? Isn't it their responsibility to educate themselves and keep updated with this epidemic? I actually wonder if more doctors know than they're willing to admit. And it's just the whole insurance of being caught in the insurance model and can't say what you know, or they'll lose their license or get into trouble. Yeah. So someone says, I've been on several months of IV antibiotics. CD57 is decreasing. What would cause the CD to decrease with IV and oral antibiotics? The CD57 is a number that comes up slowly over time. It's not so much a number used for monitoring month to month. Often, actually, I see the CD57 come up after people have been off of antibiotics. If you think about it, it is an immune marker. The IV antibiotics are doing the job for the immune system. So that kind of answers that. A TGF beta 1, if you want to write that down, is also another good lab test to look for inflammation for Lyme. That's more of a little variable that varies with changing. We do have a registered nurse at our center who works with diet. Her name is Kylie. That was one of the questions. The test, the Lyme culture is by Advanced Laboratory Services. There's a question here about that. Someone wanted to know what it was. Advanced Laboratory Services. The paperwork is into New York State to have it be credentialed. Whether or not that happens, remains to be seen. How do we treat elderly? Very caringly and with lots of love. Yeah. I mean, it would probably be a slower, gentler process with an elderly person who's gone through the Lyme thing and been frustrated and disgruntled with the treatments. Are there any promising treatment? There is a vaccine that I have heard about that they're looking at revisiting. There was a vaccine in the 90s. I'm sure most of you know of that, which was another thing about the Western blot. In the late 90s, there was a Lyme vaccine. They pulled out certain bands in the Western blot so there wouldn't be a lot of false positives. A lot of those bands are important. There was 2 or 3 of them, and they're indicative of a long-term chronic Lyme. Igenics is a lab test that we do use at the center. It adds those bands in, and also the sensitivity of it is, the way the Igenics works is the sensitivity of it is matched to the weakest of the NIH, National Institute of Health, so it's much more sensitive in getting more of an accurate result. So if the Western blot comes out negative, then that often would be a consideration to being the next step. What is the longest period of time one should be on antibiotics? Just as it depends on how our body responds to the disease, it also depends on how our body responds to the treatment. How long should one be on protocol before determining that's no longer effective? Personally, we like to change things up often at the center. Like Ron said, the spirochetes are very clever, and they also become resistant or change forms or whatever to the antibiotics. So every usually 6 weeks to 2 months, we recommend changing things up. And there was one question about the the prehistoric man on the mountaintop had Lyme disease, and yes, that is, I mean, as accurate as I know, it's been heard. I heard it at Holly Ahern, who's a biologist at SUNY Adirondack. She's been doing a lot of lectures, and she was talking about that. I don't watch television, so I didn't know about it, but that was pretty interesting. So, okay, that's my questions. Thank you for listening.
All right, so I don't have any questions, but I thought I'd just try and fill in a few areas that haven't been touched on yet. I'm Chris Riley. I'm one of the 2 acupuncturists at the center. So the acupuncture with Lyme is really a supportive therapy. The herbs and the antibiotics and things like that, as well as proper nutrition and lifestyle, represent, I think, the core of it, but the acupuncture does a really good job of symptom management. So it's known for pain relief, a lot of the headaches, joint pain, muscle aches. It can help relieve some of the fatigue symptoms, helps with joint pain. It can also help with headache. Just like with how we use antibiotics and other things, a lot of times you actually have to change the acupuncture as you go along. It's almost like it kind of figures out what you're trying to do and tries to loop around it. So it's a healing process. I think a lot of people, when they come in for acupuncture, are expecting a magic wand effect, which we do get sometimes, and that's always nice. But really, it's kind of like if you got to do antibiotics 3 a day for 2 weeks, you've got to do 3 a day for 2 weeks. Acupuncture is the same way. When we have people start acupuncture, we usually say, plan on doing at least 6, 7 sessions to really get an idea of how it's going to be affecting to you. Because we might need to try different point combinations, different theories of acupuncture, different styles of acupuncture to see what's going to work best for any one individual. But we've had a lot of success with it with symptom management. One of the other things I do is I'm one of the herbalists at the center. I do a lot of Chinese herbs. I do a lot of the research with Corey and Ron and figuring out what we think the best herbs are going to be. And therapeutically, a lot of the stuff we use has already been mentioned, the Banderol, Cemento, the Cryptolepis, which is really hard to get. I think it's like a restricted species. And we also actually formulated our own formula from primarily Chinese herbs, but also some Western herbs. And what we did is we tried to, with our herb approach, we tried to simulate our whole team approach. So when you're dealing with someone who's a Lyme patient who has Lyme-related illness, you can't just treat it as if Lyme is the only thing there. There's protozoa involved, there might be mycoplasma, there's different kinds of bacteria, there might be co-infections, and we wanted to reflect that in our herbal therapy. So one of the things we've done is we've made a 5-herb combination to try to take all that into consideration. One of them is philodendron. It's called huangbai in Chinese medicine. It has activity against gram-positive and gram-negative bacteria. It has activity against fungal organisms like Candida. And what can happen is when you've been on long-term antibiotic therapy, your own body's flora can get off a little bit. You get things like Candida overgrowth. So we wanted to incorporate that in there, and we did that with that. It also has anti-protozoal activity. Like we know things like Babesia is more of a protozoa. You can't just look at bacteria pictures. It also has anti-mycoplasma activity. A guy by the name of Dr. John Chen is a doctorate of pharmacology and an expert in traditional Chinese herbs. He's one of the eminent herbal researchers out there. Found that it works against Mycoplasma hominis, which is one of the 4 most common mycoplasma that affect human beings. So we got that in there. We've got the bacteria, we've got protozoa, we've got mycoplasma. We supported that with Coptis, which probably a lot of you know already, very similar to that. Actually has a broader anti-protozoal activity than philodendron by itself. So by combining those two, once again, you're kind of broadening the picture of what you can treat. And the two of those together are also very anti-inflammatory. They're used for joint pain, like in rheumatoid arthritis. They're liver protective, so in things like alcoholic liver disease, where you're getting a lot of toxins going through the liver, they actually help protect the liver. And they're kidney protective, so when the kidney is exposed to toxins, particularly the Coptis actually helps protect the kidney, the DNA and the cells of the kidney and the cells themselves. So we're not just treating the bacteria, we're treating all the infectious organisms, and we're treating the organs of elimination, which are liver and kidney predominantly. On top of that, we added an herb called hujang, which there's actually a lot of buzz about. You might have heard it already, the Polygonum cuspidatum. Ron actually picked that up from a pretty eminent Lyme practitioner from a conference he had gone to. And one of the things that all those herbs have in common is that they were used to treat leptospirosis by a guy named Deng Fa. He did a lot of research on treating leptospirosis with Chinese herbs quite a few decades back, and all of those were used to treat that. Leptospirosis is also a spirochetal bacteria, and it has different phases of infection. Initial phase, it's very flu-like, similar to Lyme. You get headaches, chills and fever, muscle pains. Then it kind of goes away. You're asymptomatic. Then it comes back. You can get liver damage, kidney failure, and meningitis, and a whole bunch of other things as well. So we picked herbs that have a good history against these organisms, that work well together, and kind of present our holistic approach. So I just figured I'd talk a little bit about the therapeutics, because there are a lot of questions about other kind of details. And I think that's about it for what I had to say.
I'm one of the acupuncturists and herbalists at the center. I just wanted to mention a tick spray that's made locally. It's by Quantum Herbals, and you can look. Okay, it's made by Quantum Herbals. It's a tick spray for humans. They also have a flea and tick spray for animals. It's made of essential oils and a few herbs, so it's 100% natural. And just spray to coat yourself. For your animals, you just spray it on their coat over 3 or 4 days.
Does it have DEET?
No, it doesn't. It's 100% natural. So it's made with essential oils and a few herbs. It's natural tick spray by Quantum, Quantum, Herbals. And it's a company out of Saugerties. So it's a local company too. The only place I know where they have it in store is at the Hawthorne Valley store in Ghent. Oh, and we have it at the center too. But this works really well. In fact, I know a young 11-year-old who didn't put it on this morning, and he got a tick. So I highly recommend it. Quantum Herbals, 100% natural tick spray. And I don't work for them.
What's the active ingredient in that? Is it the same for the dog and the people, or is it a bottle for both?
The only difference between the human and the animal spray is the animal one has fleabane in it. Flea, as in like bugs, fleabane.
Okay.
It's called Erigeron, Erigeron, and the common name is fleabane.
And what? I'm sorry, what was the last thing you said?
The common name is fleabane.
Oh, okay. That's the only difference between the two?
Right, and I've...
What's the active ingredient in it?
Well, it's a combination of different things.
Okay.
So there's not like one main thing, and I can read it off to you. It's essential oils of geranium, eucalyptus, ravensara, St. John's wort extract, rue, neem, wormwood, holy basil, and black walnut hulls in distilled water and 5% grain alcohol.
When you said it got the tick and it killed it, right? You said it worked?
Oh no, I said a certain 11-year-old who may be in this room didn't put it on this morning, and he got a tick because he didn't use it. But whenever we've used it, it seems to work pretty effectively as far as I know.